Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the CAUCUS Educational Corporation and their partners in public television.
Bariatric surgery for teens explored next on CAUCUS New Jersey.
Funding for this edition of CAUCUS New Jersey has been provided by Wells Fargo, NJIT, New Jersey Institute of Technology, the Robert Wood Johnson Foundation, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, the Ohlendorf Center, and by Community Education Centers. Promotional support provided by NJ.com, Small News, Big News, True Jersey, and by POLITICKERNJ.
Welcome to CAUCUS New Jersey. I'm Steve Adubato. You know, the obesity crisis in America is clearly spreading among teens. Weight loss surgery can in fact work, but it needs to be better understood. And here in the studio to do just that, we have Michaela Sufi, who had bariatric surgery in 2014 and has lost 70 pounds. Dr. Ragi Sadek, who is medical director of adult and adolescent bariatric surgery at the Robert Wood Johnson University Hospital. Jay Cardiello is a global fitness and wellness expert. And finally, back again by popular demand, we have Dr. Deborah Gill, psychologist specializing in weight and eating disorders. I want to thank all of you for joining us to discuss this misunderstood topic. Am I right in saying that, Doctor?
Well, it's just a topic that we don't talk about a lot. And obesity in children and teens and adolescents is a serious problem that's on the rise. It's almost doubled to tripled in the last 10 years.
Is it a medical condition?
Well, obesity is a medical condition overall.
It is?
Overall. It's
so
considered...
someone says, oh, you know what? You can control that. That's your fault. You should have done this. You should have done that. It's not medical, so you say?
No, this is really not true because we're looking at patients from our standpoint, from our point of view. We're not in the patient's position or the person's position to see how they're trying, how many times they've tried to lose weight and they failed. It's not about losing the weight, it's about maintaining the weight loss. And this is how we define success, how much weight you've lost and how long have you maintained it. And maintenance is usually in the medical literature averages between 5 to 7 years. Surgery works because patients will lose weight and keep it off for about at least 5 to 7 years.
But not everyone's a candidate.
Not everyone is a candidate.
But when someone is, like in your case, it can make all the difference. Now, Michaela, you tried you're how old?
I'm 19.
Okay. It's funny. It's amazing how we're the same age. So, why are you laughing? So here's the thing. You tried several different things before. You had the sleeve.
Yes.
I don't want to get this wrong. The sleeve, which you'll explain.
I will, yes. The sleeve gastrectomy is an operation by which we remove a portion of the stomach that has actually a hormone. In the cells of the stomach, there's a hormone that's being produced, which is called the hunger hormone, basically, for simple terms. It makes people hungry, eat, or crave food.
And the sleeve does what with that?
With the sleeve, what we do is we remove this portion and we remove about 60 to 70% of the cells producing the hormone.
Got it.
So patients feel natural satiety. It's just a natural feeling. They don't want to eat more than they should.
Got it. So that's what you had?
Yes.
Before you had that, how long had you tried to manage your weight?
My entire life.
Really?
Yeah, I was actually born overweight, and then my whole life I was always bigger, and it's nothing that my parents did. A lot of people are very judgmental and say it's my parents' fault, and I just think it's in my genes. It's just a part of me, and I did actually lose 100 pounds on my own in high school.
You did?
Yeah, and I gained it all back.
Over how long a period of time did you lose the 100?
About a year.
Wow.
And I gained it back in about a year after that. Yeah, and that was the first thing Dr. Sadek actually said to me when I went into his office was, it's about maintaining. This helps you not only lose your weight, but maintain it. And that's what I really, struggle with. A lot of people say to me, you could have done it yourself. And maybe I could have lost the weight on my own, but I couldn't maintain it.
Now explain, is the maintaining of it having to do with what the doctor just explained about the hunger hormone that is not there? You're not as hungry?
No, not at all.
You're just not?
I eat because I have to, because I eat to live now. I don't live to eat. I would eat a lot before, and now I eat a very little bit.
How long has it been since the surgery?
It's been 7 months as of last week, and I lost 80 pounds now.
How do you feel right now?
I feel
right on
amazing.
the show right now, how do you feel?
Amazing. I feel really good.
Wow.
I would be happy, if I stayed this weight, but I intend to lose maybe like 20 more pounds.
Okay. What do you hear right now?
I was going to add something about
Sure.
the maintaining part is really hard biologically, even without the hunger hormone changes, which sometimes the body gets that hunger back over time, over a few years, you can get that back. But the fact that you have a smaller stomach, if you learn how to eat in accordance with what your stomach tells you your body needs and the size of your stomach, you can maintain a very low-calorie diet for the long term. The reason why bariatric surgery is one of the only ways that people can maintain a really large weight loss over a long period of time is because with a regular-sized stomach, to try to maintain a really big weight loss, you need a very, very small number of calories, like almost somewhere between 250 and 400 calories less than a person who was already at that lower weight, who never tried to lose weight. So that's why so many people gain their weight back, is because the amount of calories that you need to keep your weight low is so low that with a regular sized stomach, you'd be hungry all the time.
And Jay, where does fitness fit into this?
Sure. Fitness is important, but I also would speak along your lines. Fitness also has to do with behavioral, because you need sustainable outcomes. And just as you mentioned, sustainability is the most imperative thing you're looking for. You just don't want to lose the weight and then gain it back. Fitness is very imperative, but along the behavioral, along the educational, people have to know how to look at a nutrition level, know what's good, what's bad, have the education that they can be supported by the right group of people, because things are going to change around you.
What does that mean for McKellar? What's going to change around it? What do you mean?
Well, for one thing, you're going to have to, as we were speaking before the show, the people around you are going to be either proponents or going to drag you down. I always say you have tail waggers. People are going to, just like a dog, you come home, they're going to be excited for you. Exercise is not just about working out and sweat. It's about exercising the right people around you who are going to implement positive behavior. Behavior is very important. The education you provide important. Walking, and then having people to support you and be your biggest proponent is going to make the longest sustainable outcome.
So let me ask you, are you exercising right now?
Yes.
You are? Is exercising, is it much easier, 80 pounds less, the way you were? It's self-evident.
Of course.
It is.
Definitely.
That's one of the problems that patients come to me, and patients will say, well, I exercise, and I ask, okay, what do you exercise? And they're like, I walk, or I walk my dog. And I'm like, that's good, but that's not what we're looking for.
What are we looking for, doctor?
We're looking for something, we're looking for more structured, more productive exercise. We're looking for, to me, I tell them that if your heart is not racing, if you're not sweating, if you're not moving, if you don't feel that you've exercised, how can you call it? If I've walked my dog for the last 10 years around the block, my body's so used to it, and I carry an extra 100 pounds and nothing has changed, then that's.
But doctor, let me understand this a little bit more, because McKellar was in fact a candidate, right? Did you sense that right away?
She was a candidate, yes, from a medical standpoint.
What made her a candidate? Because I want to talk about who is not a candidate.
Correct.
And also distinguish between the sleeve and other bariatric surgeries for younger people. Go ahead. Okay.
So, to be a candidate, the NIH established the criteria for
National Institute
of Health established the criteria for bariatric surgery, and it's based on body mass index. So we take the height and the weight into consideration. It gives us a number, and based on the number, we decide who's a candidate. These criteria have been developed in 1991, have not been revisited for the last almost 20 years. We're talking about. The problem with these criteria is that it defines body mass index as of 35 to 40. Or 40 and above.
This is for a 19-year-old, a 17-year-old. Isn't it different?
It doesn't change.
But should it? Well, what about if this young person has diabetes?
If the young person has diabetes and their body mass index is under 35, they don't become a candidate.
What do you think about that?
Well, absolutely. Well, we don't agree with that as bariatric surgeons, because we are actually looking to treat people earlier. Now, in Europe and Southeast Asia, they're starting to do what we call metabolic surgery. So they're looking at patients that don't meet the 35 BMI, have
body mass index.
Body mass index, maybe have a 32 or a 33, but have diabetes, and we can do an operation that cures the diabetes.
But it's not the sleeve.
But the sleeve is, interestingly, the sleeve in the beginning we thought it wouldn't, but now there is some basic science research from Europe showing that it affects and it cures some of these problems.
But I want to understand something. You were denied
Yeah.
insurance coverage multiple times.
Yes, multiple, four times, I think.
And then you finally were approved.
Yes.
Because her body mass index was under the 40.
It was
So
like
it's overweight enough.
39.5.
It was under the 40.
Hold on, 39 point.
I think it was 39.5.
Correct.
Go ahead.
For 0.5, she was denied.
Okay. So let's talk about societal attitudes. Because when we were getting ready for the show, we were together with our producers, we're having a discussion, bariatric surgery for teens. And we're thinking, okay, well, I bet there's going to be a lot of, like, if you did a survey, you know, a public survey, and you said, okay, do you support the idea of bariatric surgery for teens? I'm betting that most people would say, no, I don't.
All of them say no.
All of them. I wouldn't say all of them. I would, you know, I don't have statistical evidence. My gut tells me most would say no. Psychology of this, explain it. Assume I'm right for a second.
Why
By the way,
people
do you
would say
think
no?
I am?
I think yes. I think a lot of people would.
If I'm right, why am I right?
I think people would focus on something that is a valid thing to focus on, that the teen who's doing the surgery has to consider and weigh the pros and cons for themselves. But one of the things is that when you're young, you still have a lot of opportunities in your life where you are not going to be able to eat and participate the way, like you have college, you have weddings, you have all kinds of times when people involve food and drinking and things that you can't do after you have the surgery in the same way. You can't participate in the same way.
Which Michaela's not going to be able to do.
Right. There's nutritional changes that happen. You're not going to get exactly the same nutrition that you get from a regular diet. So you have to think about, people aren't sure exactly how that affects people long term, so that's something to consider. But usually for the people that are doing the surgery, they're weighing those things against the way that being overweight will impact their lives, and the negatives seem much worse for that. So I think there's reasons to really be hesitant and cautious, but there can be very good reasons for your health and for your quality of life to do it.
Did you get pushback?
What do you mean?
Did you get criticism? Did you get negativity?
Yeah.
You were talking about the haters before, right?
Yeah.
Did you get some negativity around doing this?
Yes. At first, I didn't tell anyone.
You did not?
No, just my family,
That's
of course.
your decision.
Yeah, just my family and, you know, the people that are close to me. And then when we did our first little thing on the news, that's when people, you know, started to find out, and a lot of people were supportive that knew
I'm not going to
me.
mention the network, but I know the network. It's a local, prominent New York station. You did something on, and there was a reaction to that, wasn't there?
Yes. For the people that knew me personally, they were really supportive, but otherwise, you know, on social media.
Is social media a mean place sometimes?
All the time.
Why were you reading that, Michaela?
I know.
That's what I said.
I know. Everyone
Because she's
told
a
me
human
not
being
to
like
read
the
it.
rest of us, that's why.
Yeah, but I had to, and there was only 2 positive comments out of 184.
No.
And I knew both of the people that were positive.
Jay, you got to talk to her. You got to jump in.
Yeah,
here.
see, one of the big things, especially coming from my industry, from the fitness perspective, is that a lot of people will see it as something that's very negative. They're not going to be a proponent of it,
Right.
which is sad, because no one's been in your shoes and know what you've gone
Right,
through.
which I'm not saying it's for everyone.
Yeah.
No, but just hold on for a second.
Yeah.
You don't have to defend yourself.
Yeah, no. You're an amazing girl, and what
Thank you.
you did and standing up for who you are is something amazing. A lot of people can't do it, and when you're doing something so great, there's gonna be more people that don't support you than do support you.
Right.
And your strength now is gonna carry on for years. That's why I see what you have and what you've done for her is gonna be sustainable because of your strength that you have.
And you're a fitness expert,
Correct.
and you advocate nutrition, and you are supportive of what you did.
Well,
someone might say, well, that doesn't make sense.
Yeah.
You say,
Well, I'm going to say this. I'm a bigger proponent in the fitness industry. I'm a bigger proponent of behavioral change and nutritional change. That creates sustainability. Fitness, I always feel what running and sweating is the smallest. If you don't have the behavioral change and the nutritional change, you're not going to create that sustainability. What you did and can carry on to others and share, if you change what you're doing on your mind, looking at labels, seeing things, and creating a
Right.
great support system, you can be a leader to a lot of women who just say, oh my goodness, I feel like giving up, and you're saying, no, there's hope out there.
I wanted to just throw out one thing. One of the big misunderstandings is that bariatric surgery is the easy way out. I'm sure you heard that on many
Too many times.
Why not?
It's not, because it takes a lot of work. You still have to be careful about everything you eat. You're eating mostly protein. You have to eat every couple of hours to give yourself the right nutrition. It's a very, and it takes a lot, you have to make sure medical things are going well. So it takes a lot of effort for the rest of your life, but it allows you to achieve results with your efforts.
Not the easy way out.
It's a program. It's a whole life change.
Exactly.
And that's what we do. What we created is a program. You take the patient from the time they get to the first initial consultation, and for the rest of their lives. They're supposed to change their behavior, they're supposed to exercise, they're supposed to be followed up from a psychological standpoint, a nutritional standpoint. Surgery is one part of the big picture to change patients' life and people's lives and get them back on a healthy track. It's like a reset button. It's like the start point.
And so let me ask you, you coming on this show in public broadcasting and telling your story, how reluctant were you?
I was a little bit nervous about it. I knew
Normal nervousness or nervous about something else?
I was just a little bit nervous about all the negativity again, but I knew it was something that I had to do because me coming on the show could maybe make one more teenager feel comfortable enough to get it, and that's good enough for me.
You know you're making a difference right now. And again, we're not advocating, I want to be clear, we're not in the business of advocating bariatric surgery for teens. We are in the business of giving people information, the best, most accurate information, so you can, together with those around you who love you, make the most informed decision about your health. There's a difference. But you know you made a difference, and you're to be congratulated for that, for having the courage to come and do this. So we thank you.
Thank you.
And by the way, it's not going to be easy moving forward, as you know that. Insurance, why? Again, I know the 39.5 BMI thing. I get all that whole thing, but why consistently rejected?
Because,
and is that changing?
Because it's based on the policy. It's not changing. The policies. The policies are still the same. The NIH criteria hasn't changed.
Even if cultural attitudes change toward this over time.
The culture has already been changing. We're seeing an increase in bariatric surgery. More and more medical professionals and primary medical physicians are sending their patients for the operation, whether they're teenagers or adults. The problem is we're only offering 1% of surgery to the patients, and 99% of patients that need and deserve the surgery don't get it.
Because it's not covered?
Because it's not covered because of insurance issues, or because they're not being told that there's an option.
So go back for a second. The sleeve is what you had. Now the Governor Christie, who we've had on many, many times, usually about contentious public issues, but we actually did have part of our discussion with him about his surgery.
Sure.
And he had
the band.
The band, which is not the same as the sleeve.
Correct.
Could you do the quick distinction for us?
So the band is basically made of silicone, and it's placed on the top part of the stomach. So it sort of creates a pouch, separates the stomach into two chambers. One is smaller than the other. And this supposedly deceives or sort of tells the brain that when this smaller chamber fills with food, you're full and you stop eating.
Okay.
When the food drips from the upper chamber, the smaller one, to the bigger one, patients can eat again. So they can eat 3 to 4 or 5 times a day.
Now that's that one. Is there a third? There's
a third operation, which is called a gastric bypass, known to the public as the stomach stapling, or known as in so many ways. It's still one of the best operations done in the world for adults.
But not for teens.
Not for teens. And the reason I don't choose it for the teens, because of the malabsorption component and some of the vitamin deficiencies that occur with this operation. And I don't think that a teenager, a 15 or 16-year-old should be subjected to this at an early age.
Okay. I want to cover some more ground here. For people watching right now, parents of young people who are struggling and young people themselves, who have tried and who think they may be a candidate, what advice would you have for them right now? And they're struggling with all kinds of issues that are physical, that are medical, but are also social and personal and all the other things that you know are real. Go ahead.
Well, first, I think the most important thing is to have compassion for yourself and to realize that losing weight is very difficult, and especially maintaining a weight loss is very difficult. And it doesn't mean that you've failed. It means that the approach of dieting is really not a successful strategy for weight loss long term. And I think that having compassion, that it might be biological or genetic, like you have compassion for yourself, which I think is great. I think another thing to really think about is if the person is eating more than their body can use every day, are they doing that because they're soothing themselves emotionally with the food? So emotional eating, or if that becomes out of control, we call it binge eating, overeating out of control. And those are sort of reasons not to jump into bariatric surgery, because if you're emotionally eating, you're not necessarily using the tool that a smaller stomach gives you, because you'll be eating even when your stomach is saying that it's full, and that you're not going to have as good a result.
You're not a candidate then, in your opinion.
I would say not a candidate. But you can work on, with a psychologist like myself or someone who does this work, helping yourself have other ways to soothe yourself and understand your emotional urges to eat.
I don't want to do this before I go back to Jay. It's interesting. Some statistics on obesity. The percentage of children aged 6 to 11 in the United States who are obese increased from 7% in 1980 to nearly 18% in 2012. Among those 12 to 19, obesity rates soared from 5% to nearly 21% over the same period, according to the Centers for Disease Control. Studies show that dieting is rarely effective for morbidly obese patients. So that being said, that sets a context. But
So
let me ask
true.
that, you've seen that as well, but one of the things you told our producers that really struck me that would be helpful to you and to many watching right now, you've often said that the language we use when we try to motivate ourselves is very important. I want to understand that a little bit more.
Sure, sure. It may seem eccentric, but how you talk to yourself. People forget this. We all look at Steve and you say, you know, I want a better physique. I want all about aesthetics. But if you don't speak it, you don't become it. I mean, in a sense, I work with a lot of professional athletes, and one of the first things that we do is we really sit down and we work on how they speak to themselves. We take out words like shouldn't, couldn't, can't, beat, and we focus on words that develop and empower. And when you have strength in how you speak, what you speak is what you become. It's what you speak is what you'll attract. And that's very imperative when you're setting up a program like yourself, or even a fitness program. Because you have to be able to speak it. If you think about it, we're in March Madness, and you think about the last 20 seconds, and they're getting ready for the big thing. That big last shot.
By the time this show airs, you'll see whether Kentucky is undefeated or not, so go ahead.
But the coach has 1 or 2 seconds to really empower, to gain control, and to make that victory shot. It's the same thing with you.
So what does it sound like? When we're talking to ourselves,
Sure.
give us a concrete example of what it sounds like, that what I'm going to do, I'm really going to do this, versus I'm going to try to do it.
You're going to demand it. There's a difference between getting revved up and demanding it. What we need to do, and I always say 5% of the people in this world make things happen, 50% watch, and 80% don't know what the heck's going on. The 5%, like yourself, demand it to make a difference.
So it sounds like
sustainable outcome.
I'm going to hear exactly. I'm trying to get you to say what the language sounds like. I am going to do something.
I am. I will. I can.
As opposed to I'm going to try to do my best.
Trying is only meant for one thing: food. You don't like it?
I'll try it.
Exactly. I'll try that pizza, but exactly.
Do you talk to yourself?
Yeah, all the time.
I do too.
How do you answer that question?
One of the positives of surgery, talking to ourselves.
All the time.
What do you say to yourself to motivate yourself? I mean, seriously, how do you motivate yourself?
Sometimes I'll look at old pictures of myself that
Do you
are
really?
good pictures
You look at old pictures?
of myself.
You don't just say, I'm not looking at these old pictures?
No, I do look at them, the good pictures and the bad pictures. Like,
Really?
Yeah.
What does it do for you?
It motivates me to do better.
You know, if someone says, what's the best approach? And I would argue, isn't it pretty individual? You good or bad idea, or is it just whatever works for her?
I definitely think it's an individual reaction. If you're if it makes you committed to take the action that's going to move you to your goals, then it's working for you. The proof is in the result.
I try to be like my own motivation. Like when I see pictures of myself, you know, around the same weight that I am now, I want to be that best me. I don't want to look at someone else and say I want to be them, because you'll never be them, you know?
You don't look at someone else?
Yeah, that's...
You don't want to be that?
No.
Doctor, what are you hearing right now? And by the way, how rewarding is this for you?
It's amazing. It's the best thing of doing, and I do adults as well as adolescents, and I get a lot more reward from the adolescent. Than
You
the adults.
do?
I see the changes, and they're very prominent. And, they change psychologically and socially. They come out of their shell almost. It's not uncommon for me to get a patient or a mom talking about her kid who's suffering in school or getting bullied or getting picked on. There is still a huge stigma with obesity. There's still a lot of prejudice against overweight people. And when you see that they're losing the weight and they're smiling and they're happy and their life changes, and it's just the most rewarding thing in the world.
Well, I'll tell you what. I'm sure there's still some unanswered questions for people out there, but you have all done a great public service. But I want to especially, on behalf of everyone in public broadcasting, say thank you to you for having the courage to come on and telling your story. Wish you nothing but the best.
Thank you.
Okay? Good luck.
The preceding program has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of CAUCUS New Jersey has been provided by Wells Fargo, NJIT, the Robert Wood Johnson Foundation, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, the Ohlendorf Center, and by Community Education Centers. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. CAUCUS New Jersey has been produced in partnership with TriStar Studios.
I think at NJIT there are a lot of smart students.
I came to NJIT for mechanical engineering because within state it's one of probably the top 3 schools for engineering.
It sort of creates a friendly competition where you know you can learn from them.
It's a great academic school.
I feel I'm being challenged, but at the same time I love the classes I'm taking.
The atmosphere of being here is like being at an upstart company. It's that same kind of drive, that same kind of passion.